Welcome to Managing Your Diabetes. This lesson is designed for newly diagnosed type 2 diabetics. It is appropriate for patients ranging from childhood through adulthood. At the conclusion of this presentation, there will be a demonstration portion of the lesson, a video, and some additional handouts for us to go over. After we have covered everything, you will need to meet these objectives to show that you understood everything in this lesson. These are the basic supplies you will need to test your blood glucose level. Keep in mind that every glucometer is different. Before using your home glucometer for the first time, you should read the manual that comes with it and familiarize yourself with the displays and prompts. Make sure to have all of your supplies gathered before you begin. These are the steps for checking your blood glucose level. Some things to remember. Let your finger air dry after you cleanse it with the alcohol pad. Make sure you prick the side of your finger instead of the pad. In addition, make sure you are alternating spots. Pricking the side of the finger and alternating spots will help lessen discomfort. Wipe away the first drop of blood and use the second drop for testing. If you are having trouble getting enough blood, don't squeeze the fingertip. Instead, squeeze the finger from the base down to the tip. After you've applied the blood sample to the test strip, hold the gauze firmly as long as it takes to stop the bleeding. These are the steps for insulin injection. When you first open a new vial of insulin, always make sure to put the date on it. Throw away any unused insulin 28 days after you've opened the vial. Your insulin dose will depend on the type of insulin and your blood glucose level. This will be prescribed by your doctor. When drawing up your insulin, make sure you are looking at the syringe at eye level. Select an injection site that has ample amount of subcutaneous fat tissue. Before injection, cleanse the site with an alcohol pad and let air dry. When cleansing the site, start at the center and work your way outward in a circular motion. When you have selected your site, grab the area by bunching it as shown in the picture. Inject the insulin slowly and steadily. When you are done, engage the safety device on the syringe. Always dispose of your used syringes in an appropriate sharps container. Keep a daily log of your blood glucose results and how much insulin you have given yourself. This log should be taken with you to your doctor appointments. These are the most commonly used sites for insulin injection. Most people find the abdomen and sides of the thighs to be the easiest for self-administration. Remember to alternate sites to lessen discomfort. Controlling diet is an extremely important aspect of diabetes management. This is a sample of some of the things you need to avoid. Learning to read nutrition labels is a very helpful tool in learning to manage your diet. Looking at the samples shown, you can see that many of these items are listed right on the nutrition label. These are some of the ideal foods for your diabetic diet. One of the easiest ways to make sure you are getting the appropriate portion sizes from each food group is to use the plate method. As you can see from the picture, all you have to do is divide a standard 9-inch plate in half for your vegetable, and the other half is divided in half again for your starch and protein. Exercise goes hand in hand with diet control. Not only will it help with your diabetes, but also with cardiac and overall health. These are the exercise guidelines recommended by the American Heart Association. Some great exercises include walking and swimming. These are the basic guidelines for preventing foot complications related to your diabetes. Because of possible issues with decreased sensation in your feet, you must monitor them daily. Discovering a wound or abnormality and getting it treated early could prevent serious complications later.